Well, hello. This is Dr. Isabelle Amigues, and welcome to the UnabridgedMD Podcast. Here we explore inspiring stories, practical tools, and expert insights for living a healthy life. Whether you're a patient, a healthcare professional, or simply curious about healing, you are in the right place. And as always, if you are looking for something that's so much bigger than just a rheumatology practice, please come check UnabridgedMD, as we are the right place to get you to remission with the least amount of medication. With that said, let's dive in. Well, hello. So this is another episode of the Unabridged MD podcast. And today I'm joined by one of our patients who has been really kind to come on the podcast to share his history of hope. Cliff, thank you so much for being here.
Oh, you're welcome.
Yeah.
I would like to do this.
Yeah, exactly. We were talking about this because it's such an incredible transformation, right?
Yes, it is. It was, it went from feeling almost hopeless at one point to now I'm here and I feel great, like I've always felt.
Yeah.
So it was, it's great.
Well, okay. So there are people who are listening today who need hope, and they may be where you were like when all of this started. Can you walk us through, walk us through your story?
Okay. Well, I used to own my own business. We made aftermarket products for pickup trucks. They're very large products. They're heavy. My job is basically design and engineering, and then boxing them up and putting them in boxes. So I'm used to lifting 50, 75 pounds day after day, putting them in boxes and whatnot. But one morning, probably somewhere in March of 2024, maybe first part of April of 2024, I woke up and my hands hurt. I mean, they really hurt. And they've never done that in my whole entire life. I could barely close them. And if I got them closed, I could barely open them. So I just kind of wrote it off to that I had, been working pretty hard. We'd been selling a lot of products, so I was boxing a lot of stuff up. So I just went about my day. By the afternoon, they had quit hurting quite so bad. And I thought, well, it's just because I've been working very hard. But the next morning, I woke up and they hurt really bad again. And it was every morning after that, they hurt really bad. I could work, but they still hurt, and it got to where they didn't even quit hurting during the afternoon. Over time, probably maybe a month's time, 3 weeks' time, my shoulders started hurting also. And I got to where I couldn't even lift my arms above the top of my shoulders. And then my hips started hurting. And it got to where it was hard to walk. I still needed to work, so I kept working. Eventually got in to see my primary care physician. She's a nurse practitioner or something like that. And, she did a bunch of blood work on me, checked me all over. And she says, well, I'm going to give you some prednisone. So she gave me prednisone, and it was like a miracle. Everything went away. So, she kept me, I can't remember what she started me out. I don't know, like maybe 20 milligrams or something. And that was for a couple of weeks. And then she started weaning me off of it. And, even when I got down to the lower doses, I was still feeling okay. But then she said, I can't keep you on this. So, it's not good for you. So, she weaned me completely off, probably within a week or less. All of the symptoms came back just instantly, So, she says, well, apparently you might have an autoimmune disease because the prednisone worked. So I thought, well, maybe she's going to put me back on prednisone. But she was just like, I can't keep you on prednisone. It's not good for you. So she kept doing tests and she said, I think you have some kind of arthritis. So, she did all these tests for all different types of arthritis, and they all came back negative. And she was just like, well, I still think you have arthritis. And I said, arthritis is in your joints. And I said, my joints do not hurt. I said, it's like my fingers are swollen up. And I said, it's like in my tendons almost. Because I said, I can feel the tendons in my arm, and where they come through your carpal tunnel and stuff. And I said, and they hurt. And I said, even in my shoulders, I said, my joints don't hurt in my shoulders. I said, it hurts down the side of my arm. And she was just like, well, no, I'm pretty sure you have some kind of arthritis. So I don't know. That went on for a month or so. And then she was like, she did put me back on prednisone for maybe another 2 or 3 weeks. And again, everything went away when I was on the prednisone. And it was like, yeah, let's just keep doing this. But, she's the doctor, not me. I don't know anything about prednisone. And then she was just like, well, I can't keep you on. So then when I went off, all the symptoms came back again. And she was just like, well, I'm going to put you on this NSAID, some kind of an NSAID, really high amount of it. And she says, let's see what that does. Well, that did absolutely nothing. I mean, it didn't make the pain go away even a little bit. And I don't know, she had given me a pretty big prescription, but after a week of it not doing anything, I just quit taking it, and I went back to her and she was like, well, you shouldn't have quit taking it. And I said, it's not doing any good. And I don't think you're supposed to go and take, large amounts of NSAID, for a long period of time. So, she kind of like almost quit doing anything. And other than she says, well, we probably should get you in to see, a rheumatologist.
So that's after how long?
Oh, this is probably, that was probably, say, it was around the 1st of April or something that happens. I started. So April, May, June, probably July, August.
Wow.
Probably almost 5 months.
Yeah.
5 to 6 months that this had gone on.
Okay.
And, and I just kept feeling worse and worse and worse. I mean, it never got better. It only got worse. Mm-hmm. So, I don't know why, if like when she first said, you have an autoimmune disease, why she didn't start looking for a rheumatologist then, mm-hmm. But she didn't. I don't know her reasons, but, she probably had some. Finally, she said we should probably find you a rheumatologist. So she started looking and she was like, well, they're all booked for 5-6 months out. So, my wife was like, there's got to be a rheumatologist you can see before that. So she started getting online and looking. We found one that I could get in like the end of November. So I was like, well, they've got an opening. Let's take it, and, and my wife was like, well, I'm going to keep looking. And she found you, mm-hmm. And she gave me your number. I called your assistant, was like, oh, we can get you in a week. And I mean, that was like a miracle for me, because I hurt so bad. I could hardly walk, I mean, I couldn't do anything. I mean, if I wanted to drink a glass of water, I had to use 2 hands because I was afraid I would drop the glass. So So it was great. And then what even better happened is that she called me back about 10 minutes later and said, I had a cancellation. I can take you tomorrow. So that's when I saw you. And, my wife had gone online and she was like, you have these symptoms for PMR.
Polymyalgia, rheumatica.
Yeah.
Yeah, absolutely.
So you have those symptoms. She says, I think that's what you have. But, she's not a doctor. I'm not a doctor, and of course we came to see you. And I mean, it was great. You were wonderful. You listened to my story. And you were like, I think you might have PMR.
Mm-hmm.
And, you did, a physical and all that on me. And it was, and you said, I'm going to go, I don't know if you used the word cure, but you said, I'm going to put you in remission.
Mm-hmm.
That is my goal, is to put you in remission. And, and from there, it's all been uphill.
It has been uphill. I want to pause you for 1 second because what I say. Oh, I'm using that too. I always tell my patients in the first visit that the diagnosis, like anything that we diagnose in medicine in general, but in rheumatology particularly, it's through what our patients are saying. So right now, if there were a rheumatology fellow, a resident, a medical student that was listening to what you just described, they can make a diagnosis of polymyalgia rheumatica, so PMR. You've described textbook what it is. So it's this pain that's sudden, that's symmetric, that affects not really the joint, but rather the tendons and the ligaments. And so if we were actually to do an ultrasound on your shoulders, we would actually see that. And the hips, it's actually mostly the tendons and ligaments. So it's funny how, and I think we're losing this a little bit in medicine, but we have to learn how to listen to our patients, right? Because you are telling the diagnosis. You're literally telling the diagnosis.
Yeah.
You were sharing with your wife the frustration of putting all of those symptoms on ChatGPT or AI and coming with those to your primary care physician and being kind of like blown out. What was the frustration? Like, can you share a little bit more about that?
Well, the primary care physician, my wife, she gets online and looks up everything, that's her thing. And she shared with the primary care physician that she says, according to everything I can find online, I think he has PMR. Mm-hmm. And she was just like, I've never heard of PMR and you need to stay offline.
Wow. Okay.
You need to quit, trying to diagnose him. I am the doctor here.
Wow.
And it was almost like, because my wife said that, it's just like they were butting heads. And matter of fact, I even would not let my wife come to my doctor appointments anymore because all she did was just make my primary care physician more stubborn and mad.
Okay. Well, that's sad. I'm going to tell you why. One, we have an incredible tool in AI. So ChatGPT is actually pretty good. Like AI is actually pretty good. It's our job, I see as a physician, it's our job to look and to listen. And if our patients are saying, look, could this be that? You've got to explain to me why not. You literally described textbook PMR. When you said you have joint pain, it was tendon. And then prednisone was kind of like a miracle drug. Right? Yes. That is PMR. That is literally what I teach medical student and resident and fellow to make a diagnosis of PMR. And then rheumatoid factors, CCP, all of the blood work is negative except for elevation of the inflammatory markers like ESR and CRP, which you had, right?
Yeah.
So like the role of a physician is to guide a patient, to reassure them, and to prevent anything that's preventable that will be potentially bad, right? And what I find sad in that comment of stay offline is one, we all know we're going to look online because that's part of our daily routine now, right? Like we all
Yeah,
look online.
it is.
And second is we should be educated about what we see online. So as someone who's a physician, yes, if I'm going to look online, if I have a question, I want my other physicians to teach me and to explain to me and to share the subtleties of what we're seeing. So you made a diagnosis even before I made it, right? There is a little piece I want to make sure that we can share about this. Can you share us from there? So we start you on medication and you go in full remission and you're able to stop the steroids in how much time? Well, within a month or something, right?
When you put me on, I think I saw you sometime around the first part of October.
Yeah.
And by February of 2025, I was off of everything.
That's beautiful.
So,
yes, of everything, actually. That's true because you were going on a trip and you didn't
I was going on a trip to Africa, and in order to get the vaccinations to go and get into Africa, they said, I had to be off of all of the steroids for a certain amount of time, or they wouldn't give me this, the shots to get into Africa. So I went off, kind of skeptical.
Everything.
I was kind of fearful that everything was going to come running back and I was going to start hurting again, but it didn't. It was like, great.
And so I think I want to share this because we have actually physicians that come on that listen to the podcast. So it's always this idea, and this is really more of a, so you understand also how I think, right? So when there's a fire, and this is what inflammation is, when there's a fire, you put off the fire. So you want to give a little bit of prednisone for sure, because that is very fast acting, but then you also want to start what we call a DMARD, so such as methotrexate, leflunomide. Some people need biologics. Basically, you want to have something that's going to suppress exactly where there is inflammation, okay? Yes. Prednisone long-term is not good. It works really well, but long-term, many side effects. But once that fire is completely taken care of, then you can back off. And so for PMR, in fact, we know that not everyone that has PMR is going to stay on those medications forever, but you've got to stop the process of inflammation. And so you've got to do it in a proper way where you don't necessarily need steroids long-term. So you first stop the prednisone, and then you stopped the other drug that we had you on. And then you've been in remission ever since. And now it's been like what? It's been a while now.
Well, that would have been sometime in, I guess, February,
Yeah, exactly.
I don't know whether it was the first or the latter part of February, but sometime in February. Mm-hmm. And I have been off everything, since then. No symptoms whatsoever. I've felt really great, kind of back to feeling my own self. It's been a great journey.
Yeah.
I mean, I'm glad that we found you. You know, I really am. You've met my wife and you know how she is. She thinks you're wonderful, that you walk on water.
Wow. I do not. I run.
I know, but but we both think you're great and wonderful, and we are feel very lucky that we found you.
Thank you. Is there something that you want to share? Like if you had been listening to this episode, right, of the podcast, while you were going through this journey of just getting worse and worse and having so much more pain, what is it that you could tell your younger self?
I think probably I should have gone and see a different doctor. Mm-hmm. I mean, it's kind of like the one I was at kind of had her back against the wall because, my wife was saying I had PMR and she was insistent that I had some kind of arthritis. But and I don't know how much she knows about.
She probably doesn't know PMR.
Or, a whole lot, about autoimmune diseases. She seemed like she knew, enough that when she gave me the prednisone that she said, you have an autoimmune disease because the prednisone helped. but that was kind of where she stopped,
Yeah.
and she kept, she did a lot of tests, for arthritis and, a lot of blood work. I had my hands x-rayed, I had all kinds of stuff
Mm-hmm.
done, and everything came back negative, but she still insisted that I had arthritis.
Yeah. And it is a form of, it is one of the inflammatory arthritis. So it's not, I don't think she's wrong in the denomination she's using. What saddens me is the fact that some physicians, some nurse practitioners, some healthcare professional don't partner with the patient and think that they are being butted against, right? It's not like your wife is not trying to hurt the nurse practitioner. She's or maybe the doctor, I don't know. But she's basically saying, look, I've seen this. In essence, your wife had more time to research your case than that doctor had, because probably she takes 10 or 15 minutes per patient, right?
Yes.
And so like when my patients come with literature, I'm always very grateful, because I'm like, well, you are the person that's the most important regarding this condition. So whatever you're going to find, I'm going to look at it. And I've learned so many things, right? Like I've learned a lot thanks to my patients. Maybe it's a new treatment. Maybe it's a new avenue. Maybe it's some sort of supplement. Maybe it's like an association of, I remember a long time ago, inflammation of the gums that could potentially be related to rheumatoid arthritis. 10 years later, it was proven, right? But it came from the patient. It always comes from the patient.
Okay.
And so it's like, well, there's no reason to feel like we're not, when as patients, when we're asking something to a provider, a healthcare worker, it's more like, hey, we've learned that. Can you teach me about this? And yesterday only, I had a patient asking me about something related to OBGYN. And I told them, I said, this is what I know, but I'm not an expert in OBGYN. So I can actually share, this is how much I know. After that, we have to ask a specialist for that specific question. And I think this is where, in a way, I wish she had right away referred you to a rheumatologist. You would not have waited so long. But, at the end, you're fine.
Yeah. Well, that's why I think back on it, and that's the way I think too. I'm like, why did she not refer me to a rheumatologist earlier?
I'm not sure. Yeah.
Especially when she said, yeah, you have some kind of an autoimmune disease, because the prednisone works. So that means you have an autoimmune disease. Why didn't she just go, we're going to find you a rheumatologist?
Yeah, I agree. I think that's the missing part.
Yeah.
And this is probably where that's the difference between the advanced practitioners and the physicians. I think that physicians go all the way to we have so much more years of studying, right? And so we learn some of the little subtleties of each condition. So for example, for PMR, you have to make sure that there's no underlying cancer, because that can be the reason for PMR. And then you treat the cancer, and then you never have PMR ever again. That's the goal. And so we wanna do all of those things, and you don't want to wait. You don't want to wait, because then you're losing time. But as you say, you're doing perfect, right?
I am.
And that's what's important.
That's what's important.
Yeah. So I'm so grateful. There's so many pearls in your story. One is trusting your gut. Two is having a partnership with your physician. I think that's really important. If you're coming with some search that you've had on Google or on AI, I think your physicians have to partner with you and be like, let's look at this. Maybe I don't know. Let me refer you to a rheumatologist. They are the one who are going to deal with this. The other thing is not giving up, right? The last thing, and that's really important, I do think you are cured. I don't use this word lightly because in general, what I offer is remission. Remission is the absence of disease without with or without medication, but you cannot say that forever it's going to be gone forever. Cured is when you're looking back and you're like, yep, you were cured because you did not need medication and you haven't had any sort of recurrence of symptoms, right? So in a way, most of our patients are totally happy to be just in remission. We try to have remission with the least amount of medication possible. In your case, you are nothing anymore, right? And that's really good. So I don't think you're cured. I think the important story here is to treat, to not give up, to treat, to get rid of the fire that is inflammation, and then to back off. To back off safely and know that we may be able to get our patients to no medication, right?
Yeah.
And to be perfect without any medication. And I think that that's actually huge, right? So
it is huge, to not have to take any drugs at all anymore.
Yeah, exactly. And feel perfect.
And feel like I used to.
Yeah.
Yeah.
And that's not everyone. Not everyone can get there, but we always try. And that's one of the things that I think at UnabridgedMD in that practice we do because we have more time. When a patient is in the insurance-based practice, the physicians don't have as much time for a follow-up visit. They have like 15, 20 minutes to see a patient. So you don't have as much time as in this practice where like we have an hour. And so we work and we're like, the goal is to have the least amount of medication. And that's something I'm sharing because I didn't realize how amazing this practice would be for that. Right?
Yeah.
Right. Like, so you have like what you're hoping for and what actually happens in reality. When I went from the insurance-based practice to I'm going to open a non-insurance, a direct care, it's the patient that's, that pays for my service. I didn't know that this would be as big. And it's been wonderful personally from a physician perspective to see that. Right. So that's like the last point.
Yeah.
Yeah.
Well, that's great because I think that's a very good point that you take a lot of time with your patients.
Yeah.
I mean, it's really quite amazing how much time you take with us.
Yeah, but that's the goal. That's the goal is to so that.
Yeah.
Well, because I think that I really do believe that what our patients are saying is the most important for the care. It's not the lab work. Like lab work can be completely normal, and you still have an inflammatory arthritis. And so it's not the lab work, it's how you feel. That is the most important. So yeah, absolutely. What are you looking forward to?
What am I looking forward to?
Yeah, now that you're perfect.
I've sold my business, basically retired. So I'm kind of looking forward to being able to do whatever I want to, I keep busy. I've always got something going on. My wife and I, we have 40 acres. It always something to do there. My wife loves to grow flowers, trees, bushes, anything. So she does that. I'm always finding something to do, something to fix, something to make, but it's not like, it has to be done. Like if you have a job, you have to get up and you go to work every morning, even if you have a small business. I think that's probably what kills a lot of small business owners is that they don't get up and go to work every morning. Maybe you don't have to sell anything that day. Maybe you don't have to box anything up, whatever it is you're doing. You might not have to do anything, have anything important to do that day, but you get up and you go to work, and so it's kind of nice, not having to do that, so, and, I feel good. So, I hoping to maybe take some more trips like the one I took to Africa, maybe to other parts of the world. I've never traveled that much,
Nice.
I've always never had the time, so yeah.
So would you say that having this condition has allowed you to see what's possible?
I think it's probably allowed me to go and not think that I had to work, 40, 50, 60 hours a week. That's not important. Maybe to, live life a little differently now, that it's not just all about work like it has been since probably I was 15 years old,
Yeah.
Yeah.
I love this. I mean, that's the beauty of our bodies, right? It's they do a knock at our door and it's like, knock, knock, you haven't paid attention to me.
Yeah.
You're going to pay attention. And if you don't listen when I'm whispering, I'm screaming.
Well, PMR does scream at you.
Yeah.
I will tell you that.
Absolutely. Absolutely. But here you are with so much more clarity on what you want to do and more time for your relationship with your wife, for the things that you love to do. And that is invaluable, right? That is invaluable.
Yeah, it is. It's great.
Well, thank you so much, Cliff, for coming on the podcast. It's I'm sure our listeners are loving the story because it's such a beautiful story for so many reasons, really. Thank you for taking some time to share the story, and and then for the listeners, put some comments, share with someone that you think will be inspired by this story. And then I will see you next week. Take care. Well, thanks again for tuning into the UnabridgedMD podcast. Be sure to subscribe so you can be notified when the next episode is up. And as always, if you think that this would be helpful for a friend or a family member, please share. Wishing you wellness. Until next time, take care.